Understanding cervical cancer, causes, prevention, and the path forward. Introduction. Cervical cancer remains one of the most significant public health challenges globally, particularly affecting women in low and middle-income regions. Developing in the cells of the cervix, the lower, narrow portion of the uterus connecting to the vagina, this malignancy typically progresses slowly over many years. Despite its high incidence, cervical cancer is uniquely preventable and treatable if caught early. Understanding its root causes, recognizing symptoms, and prioritizing proactive medical care are vital steps in saving lives. Causes and risk factors. The overwhelming majority of cervical cancer cases, roughly 99%, are linked to persistent infections with high-risk strains of the human papillomavirus, HPV, most notably types 16 and 18. HPV is an extremely common sexually transmitted infection. While the body's immune system usually clears the virus naturally, high-risk strains that linger over a long period can cause cellular mutations, eventually turning normal cervical tissue into precancerous and cancerous lesions. Several secondary risk factors can increase a person's susceptibility or accelerate disease progression. Weakened immune system. Conditions like HIV reduce the body's capacity to suppress or clear persistent HPV infections. Tobacco use. Smoking introduces harmful carcinogens into the bloodstream and compromises immune defense, doubling the risk of cervical cancer in HPV-positive individuals. Reproductive and sexual history. Early onset of sexual activity and having multiple full-term pregnancies or multiple sexual partners can elevate exposure risks. Symptoms and detection. In its earliest stages, cervical cancer is often silent, producing little to no outward symptoms. This silent nature underscores why routine medical screenings are indispensable. As the disease advances, warning signs may begin to manifest, including abnormal vaginal bleeding, such as bleeding after intercourse, between regular periods, or post-menopause. Unusual or heavy watery/bloody vaginal discharge, sometimes accompanied by a foul odor. Persistent pelvic pain or discomfort during sexual intercourse. Prevention and treatment. Modern medicine provides powerful tools to combat cervical cancer through primary prevention, stopping it before it starts, and secondary prevention, early detection. The HPV vaccine. Vaccines administered to preteens and young adults offer robust protection against the most dangerous cancer-causing strains of HPV. Regular screenings. Procedures like the Pap smear, which looks for cellular abnormalities, and HPV DNA tests allow healthcare providers to catch and treat precancerous changes long before they turn malignant. When diagnosed, treatment options depend heavily on the stage of the cancer. Early-stage cases are frequently managed with localized surgery, whereas more advanced stages may require a combination of radiation therapy, chemotherapy, immunotherapy, or targeted drug treatments. Conclusion. Cervical cancer represents a profound medical battle, but it is also a story of hope because the tools to defeat it already exist. By expanding access to the HPV vaccine, destigmatizing regular screening exams, and educating communities worldwide, society can drastically reduce the burden of this disease. Ultimately, a future free from the threat of cervical cancer is entirely achievable through awareness, prevention, and global health equity. When exploring cervical cancer, many wonder whether family history plays a role in its development. While cancers like breast, ovarian, or colon cancer are frequently linked to direct genetic mutations passed through families, cervical cancer operates differently. The overwhelming majority of cases stem from an environmental factor, a persistent infection with high-risk strains of the human papillomavirus, known as HPV. However, genetics and secondary factors still influence how the body responds to this common virus. Cervical cancer itself is not directly hereditary. A mother cannot pass a cervical cancer gene to her child in the traditional sense. Yet, researchers have observed that having a mother or sister with cervical cancer slightly increases a person's individual risk. Rather than a direct genetic link, this pattern is largely explained by shared environmental exposure, similar lifestyle habits, and subtle inherited variations in the immune system. The immune system is the primary line of defense against HPV. Most people who contract the virus clear it naturally within 2 years without ever developing symptoms or health problems. However, individual genetic differences can affect how efficiently immune cells detect and eradicate high-risk HPV strains. If a person inherits immune system traits that are less effective at targeted antiviral responses, the virus is more likely to linger. This persistence allows cell damage to accumulate over many years, significantly increasing the likelihood of precancerous lesions developing into cervical cancer. Additionally, extremely rare inherited conditions can elevate susceptibility to unusual cervical tumors. For instance, Peutz-Jeghers syndrome, caused by mutations in the STK11 gene, and rare variants in the DICER1 gene are associated with higher risks of atypical cervical malignancies, though these represent a tiny fraction of total cases worldwide.